In 2014, I was invited to join a committee to help get the Outer Banks Hospital to become an accredited cancer program. We had also, in our database, looked and found that a high percentage of our patients were coming into obstetrical care without having been vaccinated for HPV. We saw the opportunity to partner with our local health department, the education system, and our practice to help promote HPV vaccination.
Dr. Dwyer brought a very passionate plea to the Cancer Committee early on. We went back and looked at the cancer registry data for Dare County and found that in fact there was a disproportionately higher number of head and neck cancers and some very advanced cancers, as well as other GYN cancers. We agreed that HPV vaccination would be the next cancer prevention program that we would work on.
So part of our goal was to cooperate with the primary care providers and all of the medical care providers, as well as the schools, on a one-to-one basis. So we met with school administrators, with nurses from the schools, with students, but we also thought it was important to send out a letter to our providers in the community that we were not able to necessarily meet on a face-to-face basis. And this letter was a nice way, I think, to summarize the importance of the program, as well as our early data that showed this is a very effective vaccination program.
I think historically when people think about HPV vaccination, they haven't thought about cancer prevention. This program was born from the Cancer Committee, and having been born from the Cancer Committee, we really stayed focused the entire time on cancer prevention. One of the first things we did was write up an article for our Health Coach community newsletter for the public. That article really framed our message, which was HPV vaccination equals cancer prevention. We like to pair the newsletter with a short, what we call a health clip, that features an expert talking about the topic we've written about.
As a healthcare provider, I strongly recommend the HPV vaccine. As a parent, I will have my children vaccinated. One of the most important things you can do as a parent is to talk to your child or teen openly about their health and making safe choices.
We also took advantage of an opportunity to get in front of local parents and talk to them about HPV vaccination as a cancer prevention initiative. I think when you embark on any innovative, challenging, potentially challenging initiative, leadership and support for the goal is essential. President Ronnie Sloan supported this initiative, as well as our superintendent of schools, Dr. Sue Burgess, and asked her, would the schools be willing to partner with us on this cancer prevention initiative? And when the answer to that question was yes, we really knew we were on our way to being able to reach families in our community.
If there's anything that we can do as parents to prevent cancers, why wouldn't we take advantage of that and make sure that we're able to provide the best outcome for our children later in life?